Hello guys, welcome back to my channel. So today's topic is adverse drug reaction. So let's start with what is adverse drug reaction. Whenever we take a drug, this drug go and bind with a receptor and show its response. This response can either be desirable, that is what we call our therapeutic effect, or it can be undesirable, that is adverse effect, that is unwanted. Basically, adverse drug reaction means any undesirable, unwanted, unintended consequences that occurs after the administration of the drug. Next, we have the classification of ADR. So, classification of ADR are following types, starting with type A or augmented effect. So what is augmented effect? These effects are usually predictable in nature and are dose dependent. Suppose we are giving a drug. This drug will go and it will show its pharmacological action. But sometimes it happens that this pharmacological action gets augmented or the intensity of its action increases. As a result, it shows some adverse reactions. So this is what we call augmented effect. Its example is antihypertensive drug. For example, a person is given an antihypertensive drug. We can already predict that this antihypertensive drug can cause hypotension at some point. So this is predictable. Also, for example, anti-diabetic drug. When we are giving an anti-diabetic drug, we know that at some point it will cause hypoglycemia. So this is what we called adverse drug reaction type A. In this type A, we have two subgroups, that is toxic effect and side effect. Now, what is the difference between a toxic effect and a side effect? Toxic effects are those effects that are related with its action. Let's take an example in this case. A person is having a problem, like a person taking any drug. Let's take an anti-diabetic drug. This drug will cause hypoglycemia. We have already predicted this. So this is toxic effect, meaning we already know that it will cause a toxic effect. This effect is hypoglycemia. But in case of side effect, it is different. It is not related to its action. Like a person is having bradycardia. We know that atropine, it increases the heart rate. So in that patient with bradycardia, we can give atropine and atropine will show its effect. But atropine, we also know that it causes dry mouth. So in this case, dry mouth, which is not related to our desired effect, it is not related to our problem, it is something that is additional. Although atropine is showing its effect by increasing the heart rate of the person, but along with that, it is showing some reactions that are unwanted, that is addition to that particular problem, that is dry mouth. So this is a difference between toxic effect and a side effect. Now, second we have type B or bizarre. These type of effects are not at all predictable. It happens suddenly and they are also not dose dependent. Whatever be the dose, it may show up. In this case, we have two types, allergic reaction and idiosyncrasy. Like allergic reaction may not happen in certain people after taking a particular drug, but it may also seen in some person that are given in same dose that the other person is given, but the other person is not developing allergy, but the next person is developing that allergic reaction. Then we have idiosyncrasy. Idiosyncrasy is also something that is genetical. Same dose, same drug is given to the person. One person may get some type of adverse reactions to that drug, but the rest 100 people or the other people will not get any type of reaction to that drug at that particular dose. This is something that is genetic. The person is genetically not adapting the drug. So this is about idiosyncrasy. Like example is penicillin. In few people, penicillin causes allergy. In few people, they don't. So this is an example. Third, we have type C or the chronic. In this particular case, the drug reaction, adverse drug reaction is seen when a drug is being continued for very long time. Like steroid, if it is given for very long period, it causes osteoporosis. So this is called as chronic type. Then we have delayed, the type D. In this case, the action or the adverse reaction that is seen, it is seen after many years after taking the drug, like in case of antipsychotic drug. In this case, tardive dyskinesis is the side effect of the antipsychotic medicine. So these drug, it is used to treat schizophrenia and some other mental problems. So in this case, what will happen is there will be stiffness, jerky movement, and some other uncontrollable movement of the body. So this is a result of the antipsychotic drug when it is taken for very long period of time. Then we have type E, that is end of dose. In this case, after the drug is taken, when it is discontinued, at that time the adverse drug reactions are seen, mostly the withdrawal symptoms. In case of some addictive drug, after the drug is discontinued, some of the reactions are seen. That comes under type E, end dose, end of dose. Also, there is an example of clonidine. Like we know, after clonidine is discontinued, some severe hypertension is seen. So this is one of the example of end of dose. Type F is failure, means the failure of therapy. A certain drug is given, but the drug have not shown any effect. It has failed to show its therapeutic effect. So this comes under type F. So, to keep an eye on these areas, there are some programs. In India, this program is known as National Pharmacovigilance Program in India. Likewise, other countries also have their own program. But before that, we need to know about pharmacovigilance. So, let's see what is pharmacovigilance. Basically, pharmacovigilance are the activities that are concerned with detection, assessment, understanding, and prevention of adverse effect or any other drug-related problems. So first, starting with detection. In detection, it is seen that whether or not the drug is producing any kind of adverse effect. If it is producing, then how severe it is. For detection, there are two methods, that is adverse event and adverse drug reaction. These two terms are very important to understand in case of detection. So let's see what is adverse drug reaction. We have to understand that when a drug is given, we expect it to work in a target site and show its response. But not every time this is what happens. Along with the target site, it also shows some effect in some other places. So these effects that they are showing in the other place, the influence can be good or bad. And if it is not good, if it is irritating to our body, then this effect is simply known as the adverse effect. So let us understand this with an example. NSAID, it is taken for the fever, pain, inflammation to be treated. But in someone who's taking this NSAIDs for longer period of time, they can experience stomach irritation and even bleeding. So why this happens? This happens because apart from acting as an anti-inflammatory agent, it also reduces the production of prostaglandin. And prostaglandin is a chemical that is present in our body to protect the digestive tract from the stomach acid. So, when NSAID is used for longer period of time, they show stomach ulcer as its adverse effect. So, from here we can understand that NSAID that is used for treating fever, pain, It is also showing some undesirable effect when used for longer period of time, that is ulcer. So this is what we call adverse drug reaction. And what is adverse event? Adverse event means any unexpected, unfavorable event that occurs when a patient is on a medication and or any other treatment procedure. But here in this case, the undesirable effect may not be reason of that effect. It may not have any causal relationship with the medication or the treatment. So let us understand this with another example. Like if a person is having a medicine for any problem that the patient is having, but after taking the medicine during the treatment, the person is seeing rashes. This rash can be or cannot be the reason of the medication. It is not 100% sure that the rashes that are seen in this case are because of the drug. So this is the reason that the effect that we are seeing, it can be in relationship with the drug or it cannot be. So this is what is adverse event. When the person is in a medication, any kind of effect that is seen, of course the adverse effect that is seen in a patient can have relationship with the drug or it cannot, but still it comes under adverse event. So the basic difference between ADR and AD is that in case of ADR, the drug is always present. Drug is the actual cause of the problem. Whereas in case of adverse event, drug may or may not be the reason for that problem. So this is a basic difference. So next we have assessment. In assessment, they assess if the drug is the actual reason of the problem or not. If it is, then how severe the problem is, how severe can the adverse effect be. So for assessing, there are two methods that can be used, that is de-challenge and re-challenge. So let us stick with our previous example and understand what is de-challenge and what is re-challenge. The patient has taken a drug and then rashes appeared. So first what we have to do is, let's stop the drug. When after stopping the drug, if the rashes disappear, that means the drug was the reason of the rash. It may happen. This is de-challenge. After some days, after disappearing of the rashes, again the medication is started. And when the medication started, the rashes again appeared. It is called re-challenge. Meaning we can confirm that the drug was the reason for the rash, because previously when the drug was stopped, the rashes also disappeared. But again when the drug was started, again the drug caused the rashes. So here it is confirmed that drug has caused the rashes. So the first where the drug was stopped, it was called de-challenge. And after some day, when again the drug was administered to check if the rashes were due to the drug or not, it is called re-challenge. But every time this method of de-challenge and re-challenge cannot be used. At that time, there is a scale that has been used, that is called the Naranjo scale. This is a Naranjo scale, and in this case, there are some questions that have to be asked to the patient. If these following things are happening to the person or not. According to that, the score will be added up and it will be seen that if the drug is actually the reason of the following adverse effect or not. Next, we have the understanding and prevention. For understanding, after the assessment is done, and if the drug is actually causing the adverse reaction, then why is it causing it and how is it doing so? So this is what is done in case of understanding. Once we know why it is happening, we can easily prevent the adverse reaction, which is done in case of prevention. So This was about the pharmacovigilance and how they are detecting an adverse effect. Next, we have National Pharmacovigilance Program in India. First, we have ADR Monitoring Center. These ADR Monitoring Center are present all over the India. All the medical colleges, hospitals, and other medical institutions are asked to report the adverse drug reactions that are seen in their patient. If a patient develop any kind of adverse effect due to any drug, they monitor them and report them to these monitoring center. These monitoring centers all over the India put their data into a software that is called as Vigiflow. Vigiflow is present in all the area monitoring center. Vigiflow, after it collects all the data, it forward it to the National Coordination Center. This National Coordinator Center is the IPC, the Indian Pharmacopoeia Commission. The headquarter of this is in Ghaziabad. So after National Coordination Center have collected all the adverse reaction data, they will send it to the International Monitoring Center. This International Monitoring Center is the Uppsala Monitoring Center that is present in Sweden. They collect the ADR reports all over the world. All the other countries like India, they also have their own monitoring center, and from there they send their data to this Uppsala monitoring center. There they are in coordination with the FDA and they see if the drug is to be marketed or not. And also they make sure that if there are some adverse effect, then it is to be written in the label of the container of the drug. So these are the things that are happening. After that, they can either put a warning label on the drug or they can recall the drug from the market. So this was about the pharmacovigilance program in India and how they are continued in the international level. So this was it for today. I hope this video was helpful for you. If it was, then please don't forget to subscribe to my channel and let's meet in the next video. Thank you.